I do want to go back to Will's original question about like kind of like what's the positive vision?
Yeah, no, and Tim, I wanted to bring this up because you've become something of a healthcare expert, a wonk, if you will. You've been giving talks on this subject about healthcare, and like obviously, look, we know what the Democrats are coming up with is insufficient, but. So it behooves us to talk about what would be sufficient.
Yeah. And I want to touch on this for 1 second. I don't think we've fully kind of discussed how insufficient the Democratic plan is, not just on the subsidy level, right? Like we know that like Republican vision is Mad Max Thunderdome, put the ill in cages and let them fight, and use the betting proceeds to pay for one of their fucking surgeries. The Democratic vision is build a massive infrastructure, which is right now the ACA, in which the federal government heavily subsidizes private companies, but does nothing to actually regulate cost and let the magic of the market and smart consumers or whatever yelp their fucking like gallbladder removal or whatever and drive costs down that way. But what that also does is that the Democratic plan of fixing health insurance by subsidizing the ACA is a de facto or implicit endorsement of the status quo, which is corporatist and employer domination of healthcare and healthcare needs.
Well, that's not even a plan. That's just, we already did this, so we just have to fund it.
Right. But it fails to be an actual exploration or an actual like push for making things better for people in America, right? Like step back, for example, if what kind of healthcare you are permitted to have and how much it costs you is derived as a function of who your employer is and how like generous your employer happens to be. Here are repercussions of that. One, like if you have the wrong kind of employer, you can't get contraception, you can't get abortion, you can't get hormone therapy. That was the Hobby Lobby versus Burwell case, right? A closely held company, which is basically a company that administers its own insurance, has the ability to deny its employees certain kinds of healthcare based upon whatever the fuck they base it on. And then you saw an extension of that in the Little Sisters lawsuit. Like the way around that is, okay, so Hobby Lobby or whomever hires somebody to administer their insurance, and they don't want to provide or pay for contraception or abortion or hormone therapy or whatever. Okay, well, they can then sign a form saying, we choose not to approve these things, and then a third party will provide the employees contraception when they need it. But now, you'll see in another lawsuit, Little Sisters of the Poor, like that employer won't even sign that form because signing it would then cause their employee to get contraception. Like this is the status quo the Democrats are advocating for, where like when everybody has employer-sponsored insurance, like you are still, your body and the commodification of the body and the futures and whether or not you get sick or poor and the profitability thereof is still beholden by a private capitalist entity.
Well, they didn't anticipate those cases.
We already had these. We've had things like this for a long time. Like one of the big reasons that unions are struggling right now is because the norm for how an insurance plan is structured is you push more and more costs onto the individual or the consumer, if you want to use the libertarian vernacular. And because these health insurance plans are more expensive and worse, labor unions have to spend a ton of fucking time negotiating like their way up from terrible plans to better plans, which is why they're like having a hard time fighting for things like safety or wages or like any of the things we actually want to aspire. Like this has been a problem since the fucking 70s. Like costs have been increasing since we began measuring them, and the Democrats have never provided a positive, like affirmative answer for how to solve this. Their best case scenario is we all have employer-sponsored insurance in the fucking cavernous hell world of capitalism where that lives, or you have if you don't have an employer because you're busy like being a Lyft driver and a Grubhub person and a Postmate, which is which until you learn to code is the preferred better skilled, better wage path of the Democratic Party 2018. You have the insurer pool, and the only way to make that sustainable is to just give over fucking $1 jillion. I mean, a jillion sounds like a joke, but it's not. I mean, Medicare Advantage fraud alone is $300 billion over a decade. Like we're wasting a ton of money. I would say, what is it? 30% of the amount of money which the government spends in a given year on healthcare, which is I think is like $2.something trillion, is just subsidies to employers and to insurance companies.
Well, a couple of weeks ago, the Better Deal platform, one of the planks that the Dems unveiled was something that you talked about on the show, Medicare drug negotiation.
Right. That's good. That is a good and important thing. But like by no like you don't champion that as the end goal. That is
Right.
one step of many to get there, right?
Yeah.
Absolutely, like Medicare, and like one, we should just fucking nationalize the drug industry. There's no great
Yeah.
reason to have them around.
Oh wait, Tim. What about all their innovation though?
I've got a great innovation. Let's nationalize them. I mean, like their innovation is they discovered they could just steal public research and use that to create a profit.
And they can time release OxyContin.
Oh lordy,
That's a good innovation.
They got all those free pens at the doctor's office.
yeah,
true.
that's true.
That's
That is
true.
true.
I mean, like, this is a tangent, but like Trump would have a great platform for bringing down drug costs. You say it's time for other countries to pay their fair share or whatever. We're no longer going to subsidize the rest of the world. But you know, like whatever, like he could do that if he wanted to, but he doesn't want to because he's a fucking piece of shit. Anyway, so that's the Democratic version. Like Republican version is Thunderdome. Democratic version is like Thunderdome, but like you get to have a beanbag chair at the office because your employer has full control over your body. Your health and your well-being are still commodities, and if you're unemployed or you don't have sufficient employment to qualify, we'll just pour money at the problem, but not actually address the bedrock of it. But the actual, like the thing that we know that we want, the thing that we know that we have is to push towards health justice. And the biggest tool, like the biggest mechanism of health justice is universal federal single payer. Universal federal first dollar
You
single
might call yourself a health justice warrior.
Tim, so like, look, we know this is what we want. We know this is the way out of this mess, right? Like, this is the only sane and humane solution.
And electorally popular.
And it's electorally popular, and it seems to be like there are some on the Democratic side who are coming around to this or realizing this or at least willing to talk about it.
A majority of the House Democratic Caucus has co-signed the single-payer
They're at least
legislation.
paying lip service, which is way better than
Okay.
nothing else.
But when you bring this up and when you talk about this, I think one of the pitfalls or one of the hurdles that we, or as anyone who is an advocate for single payer, has to clear is the skepticism. Forget people who just hate the idea of any kind of social insurance or sort of universal benefit at all. Forget them. There are people, I think, who agree with the idea theoretically, but have sort of they've allowed themselves to believe that it's some sort of utopian dream that can't happen, and that, like, you know, the pragmatic thing to do is to just sort of chip away at these little bits and pieces because single payer clap is just not happening.
Right.
How do we address the concerns of the, I don't know, pragmatically problematic, I'll call them?
The scaredy cats.
Gently, I think, because fortunately there's a whole lot of research information that I think can win them over. I don't want to, spend time trying to convert those who are fundamentally opposed to the idea of insurance, but those that question or are curious, I think there's a lot of room to talk for. So here's a couple of simple things we can talk about. One, like, we're already spending the money to pay for single-payer healthcare. We can just allocate the money differently. The goal isn't to cut spending, it's to reallocate spending into better places that provide more care for more people. Right now, I think in 2015, the U.S. spent, I don't have my numbers in front of me, but $3.1 trillion. The entire U.S., like as a country, including private people and individuals, spent $3.1 trillion on healthcare. Of that, 2/3 was direct federal spending. Of that 2/3, half was Medicare, and the other half was a combination of Medicare, Medicaid, and the VA. The other half was combinations of subsidies to private companies, tax cuts for employers because of employer-sponsored insurance, and then the just massive subsidization of insurers through risk adjustment, Medicare Advantage, etc. And so we were spending a huge chunk of money to get most of the work done, but that in no way, we haven't begun to address the idea of bringing unit costs down, which is what a single payer can do. Right now in the US, we pay on average 40% more for a given procedure than like France does. A great example of that is the MRI. The MRI is a machine that prints money, basically. I think it has like a 1.5 year payback window, so after that, you're just fucking printing fat sacks of cash by pushing a button and scanning a body. It costs, I think I got this from Sarah Cliff at Vox, $1,100 to run a scan in the U.S. It costs $200 to run a scan in Australia. And that delta is not because it's a more advanced technology here or whatever. It's because people that run MRIs put them in hospitals, and hospitals are allowed to build more for no good reason at all. So therefore, costs go up. Like you've got this entire hierarchy of bullshit middlemen that find ways to juice costs. Independent insurers aren't big enough to cut through those, and the federal insurer, Medicare, right now, like does a lot of the work, but that doesn't trickle down to everybody. A federal single payer has ability to like massively reroute and push costs down, and really ultimately redirect spending. And here's a great example of that. I was speaking at North Jersey DSA a while ago, which ruled. Way to go, North Jersey DSA. It was really, really fun. I love going to DSA meetings. And somebody brought up a very good question of, like our local hospital said if single payer passed, they'll lose $80 million a year, which is a pretty slick reinterpretation or spin of what would actually happen. Here's the counter argument to that. Those $80 million a year represent hospitalizations that don't need to happen. The most expensive thing you can do is go to the ER or get an inpatient surgery. Hospital-related bullshit is the largest driver of healthcare spending in the U.S. That's because hospitals have been aggregating and merging and acquiring each other for the past 20 years, and now there's fewer and fewer local care clinics and more hospitals. So if you're feeling sick, you go to the ER and you get like the $10,000 of procedures there, as opposed to going to like your local primary care provider and getting like $100 or $20 or really in the best world free checkup and pushing costs down that way. So here's an example of how you can do that. Right now you've got home health aides, right, which are people that come into your house and take care of your parents when they're sick, but not sick enough to need to be like intubated or be like in the ICU or be inpatient. That's great. Like everybody is happy when that happens because people want to stay at home because it's more humane and it's nicer. You can perform the like not quite like doctor level of care with a regular person who's got some medical training. There's going to be 1.2 million home health aides by 2020. Right now, they receive on average a salary of $11 an hour, and they're billed at and they're billed at $135 per visit. So a great thing to do would be to reallocate some of that $80 million we spend in unnecessary inpatient admissions and pay home healthcare workers more so they can do better work for people in the comfort of their own homes. Like that net drives costs down, but also provides any kind of healthcare regulation needs to both address cost issues and address like scope and coverage issues. And you can do both at the same time through a federal single payer. You can do all these things that encourage folks to receive better care that's preventive or less expensive in a more humane way for them, as opposed to pushing everybody in the hospital where costs skyrocket.
Yeah, it sort of. This makes me think a little bit about some of the very bad Democratic messaging this past week, and it sort of ties into their arguments against single payer. Something that I saw a lot this past 2 weeks was this bill affects 1/6 of the American economy.
Yeah.
Do we really want to make that decision in secret? Put away with how clumsy that wording is and how little people give a shit. No one's turning out at the midterms for
1/6. That's nearly 1/5.
Yeah, for 1/6 of the American economy. But it ties into these sort of centrist arguments against single payer that health costs are such a big part of our economy that we can't just somehow, if we do single payer, no one's going to work in healthcare anymore. It's sort of like the arguments about socialism that there will be no more industry. But it does make you think of all those comparisons between our health costs and the health costs of countries with single payer, just fully socialized medicine. You can't look at that graph, that 17%, and that portion of our GDP versus anyone else's, and think that it's not just the result of what Tim talked about, the inefficiencies of the system and the price gouging and profit seeking of all of these hospital companies, of the drug companies, of everyone else. And I don't know how you can look at that and think that it's sustainable in any way. It's after 2 massive dumbass bubbles, like just in my lifetime alone, bursting horrifically. We have this third one that we've been building up this entire time. And the argument for not fixing it, for not deflating parts of this bubble that mostly just go towards profit-seeking executives, is that well, this bubble's a big part of our economy, and we just have to keep it in perpetuity. And that's somehow the practical outcome, that we're going to have inflated costs forever, and that there's never going to be any market panic, that it's never going to burst all over everyone, and that we can effectively gouge everyone forever just because, I don't know, people can't do clerical work at any type of NHS type thing we could create.
The economy argument is such a bullshit one because I am totally fine with the gross amount of healthcare spending. I think you want to do more with that. If you bring costs down, you can use that money to do more. And like, I'm not an economist, but I am aware with the idea that different kinds of federal spending stimulate different amounts of spending elsewhere in the economy, right? Like every dollar spent by the federal government on building a bomb creates like $1 or less of spending elsewhere, right? Because that doesn't stimulate an economy. The number I've read somewhere was that every dollar of federal spending in healthcare creates $6 of spending elsewhere. Because it's a big fucking intricate world. So keep spending that money, but spend it better. You reduce so the one thing I wasn't clear on that I want to go on before I jump into this. But one thing I wasn't clear on. One of the other ways, a really, really big way that the government drives down healthcare costs is by just putting together a list of how much shit costs and keeping everybody to it. Right now, there is no list of how much a thing costs. Medicare is one of those. That's what the thing that the AMA fucks up. I talked about that a couple episodes ago. But like, that's an easy, immediate way that you bring costs down. Is the government says, here's how much shit costs. Here's the multipliers based upon like where you live and how complex the thing is, and that's what we're sticking to. And that immediately would have dramatic ramifications about costing overnight. But really, more importantly, I think I said before that I really want to touch on is the idea that the federal single payer is a giant instrument for healthcare justice. And you can begin to realize this by a federal single payer means that finally the federal government bears the costs of providing care, like paying doctors and paying nurses, and not providing care, which is people getting sick and people dying and people getting sicker from preventable conditions that somebody else should have caused. Your insurer doesn't give a shit about you long term because either you will change plans and go to a different insurer or you'll get old and go on to Medicare. So they're they care about keeping your costs down for as long as you are with them so that they don't need to pay for it, but they're not really like a positive actor who cares about like your actual long-term well-being because those costs aren't borne by them because you become not their problem. The federal government, which is just a proxy for like society, everybody around you, does bear the costs of you getting sick long-term. So I think it's pretty reasonable to make them be the people that bear the costs of providing care in the first place. Like, join those incentives together. And so when that's the case, you can begin doing things that you see. There's this thing called the social determinants of health, which is like understanding what happens in the world to cause folks to get sick and then trying to address it. I know the New York Medicaid, happy birthday Medicaid, by the way, is like a fucking undervalued, unsung hero in America. It's really been tackling these things. The New York Medicaid director, Jason Helgerson, wrote a big paper on this. It's fucking dope. Anyway, if you have a federal single payer that bears the cost of providing and not providing care, then if part of your population is getting sick and dying because the food they have access to is unhealthy and the food that is healthy is unaffordable because it's not fucking profitable to sell commoditized healthy food where they live, and so they live in a food desert, then the federal government has an incentive to provide affordable, subsidized, or free healthy food to that population because food is healthcare. If their housing conditions, lack of affordable housing or lack of housing altogether are causing people to get sick and die because you die from exposure way faster than you die of brain cancer, then providing affordable or subsidized healthcare becomes a form. Housing becomes a form of healthcare.
Doesn't that open the door to this kind of nanny statism that these conservatives are constantly pretending to care about?
Right now,
would the government have an incentive to ban smoking or alcohol use?
Right now, we delegate these decisions to private entities who seek to make profit off of it. I would rather delegate it to like the collection of people that make up government, make up society, right? Another good example, right, like a thing that isn't really addressed is that like if a person in your population is being assaulted or beaten or harassed like at home or at work or by the police or by the domestic partner, then providing like safe havens is a form of healthcare. Like all these things fall under the umbrella of health justice. That's the actual thing we want to get to. Like single payer is the tool, health justice is the goal.